A pleasant day to our respected teacher, Ma'am Maliksi. Good day to you, ma'am. I am Lara May Polo from the Group 11 and I'll be the first to discuss and introduce about our topic, sexual dysfunction, along with delayed ejaculation and erectile disorder. So first, alamin muna natin what is sexual dysfunction. So ang sexual dysfunction is iba't ibang kondisyon na nakaka-affect sa kakayahan ng isang tao na mag-engage sa sexual activities. So pwede ito siyang maranasan ng kahit sinong tao regardless of the gender. So babae man o lalaki and ano man ang edad, and may malaking epekto ito sa emotional well-being, sa relationship and quality of life ng isang tao. So for the history of sexual dysfunction, sa unang edisyon ng Diagnostic and Statistical Manual of Mental Disorders or DSM-1 noong 1952, hindi pa gaanong napagtuunan ng pansin ng sexual disorders. So kasama lang ito sa mas malawak na kategory ng personality and sociopathic behaviors. And during this time, limitado pa ang kaalaman tungkol sa sexual health and may societal taboo rin kaya hindi siya fully recognized as a distinct issue. And then, nilabas ang DSM-2 noong 1968 and mas nabigyan na ng pansin ng sexual dysfunctions and isinama na ito sa tinatawag na psychosexual disorders. Although ito ay isang step forward, broad pa rin yung categorization nito and wala pang specific na diagnosis tulad ng sa ngayon. So, this is marked the start of a more systematic way of identifying sexual issues, although marami pang kailangang improvements noon. Sa DSM-5 noong 2013, mas pinalawak na ang diagnostic framework para sa sexual dysfunctions na tinukoy hindi lang sa physical causes kundi pati na rin sa psychological factors. Binigyang emphasis din ang pag-consider sa patient distress and ang epekto ng gender and cultural context sa sexual health. So, specific na ang classification ng disorders tulad ng erectile dysfunction, female sexual interest or arousal disorder, and premature ejaculation, which allows for a better diagnosis and treatment options. So, for example, sa DSM-5, ang female sexual interest or arousal disorder is isang kondisyon kung saan merong kawalan or mababang level ng sexual interest or arousal na nagkukos ng distress sa babae. And ang specific na categorization nito is nakaka-help para mas maintindihan ng clinicians ang mga challenges na hinaharap ng mga babae na may ganitong condition. So, what are the causes of sexual dysfunction? So, ang sexual dysfunction is maaaring cause ng combination ng biological, psychological, and social factors. So, for the biological factors, it can be because of hormonal imbalances. So, kapag hindi balance ang hormones tulad ng testosterone, estrogen, or thyroid hormones, pwedeng maapektuhan ang libido and sexual performance. So, example, kapag mababa ang testosterone levels ng isang lalaki, maaaring bumaba din yung kanyang sexual desire and magkaroon siya ng erectile difficulties. And it can also be because of chronic illnesses. So, yung mga condition tulad ng diabetes, cardiovascular disease, and iba pa, maaaring makasira ng sexual function dahil sa nerve damage or poor blood flow. For example, ang diabetes is maaaring cause ng neuropathy and impaired blood circulation na nagiging cause din ng erectile dysfunction sa mga lalaki and reduced sensation sa mga babae. And it can also be because of medications. So, may mga gamot tulad ng antidepressants, antihypertensives, and contraceptives na mayroong side effect na nakaka-affect sa sexual function. So, for example, may mga SSRIs or selective serotonin reuptake inhibitors na ginagamit para gamutin ang depression. Yun siya is maaaring mag-cause ng delayed ejaculation or pagbaba ng libido. So, or it can also be because of psychological factors, which are anxiety and depression. So, ang mental health issues tulad ng anxiety and depression is maaaring magpababa ng sexual desire and performance dahil naapektuhan nito yung mood and energy ng isang tao. For example, ang taong may generalized anxiety disorder is nakaka-feel ng excessive worry na nagiging cause ng pagbaba ng arousal and sexual satisfaction. Or, for example, past sexual trauma. So, ang mga experiences of sexual abuse or trauma is mag-result siya ng long-term psychological barriers sa sexual intimacy. For example, survivor ng sexual assault is maaaring magkaroon ng difficulty sa trust and intimacy na nagiging cause para iwasan niya yung sexual intimacy. It can also be because of social and cultural influences. So, yung mga cultural attitudes like mga beliefs and norms ng society tungkol sa sexuality is maaaring maka-affect sa sexual behavior ng isang tao and minsan nagiging cause ng dysfunction. So, for example, sa mga culture kung saan tabu ang open discussions tungkol sa sex, so, ang mga tao is maaaring makaranas ng anxiety or hiya pagdating sa sexual activity. It can also be because of relationship dynamics. So, ang poor communication skills or unresolved conflicts, lack of emotional connection sa relationship is maaaring mag-contribute rin sa sexual dissatisfaction. For example, kapag madalas nag-aaway ang mag-partner, pwede itong mag-cause ng hostile environment na nagpapababa ng desire para sa physical intimacy. Now, let's proceed sa symptoms and warning signs ng sexual dysfunction. So, ang mga symptoms can be physical, emotional, and behavioral. First is the persistent lack of interest in sex. For example, ang isang tao is maaaring patuloy na mawalan ng interest sa sexual activity na nagiging cause ng stress sa relationship and personal na frustration. Second is the difficulty achieving or maintaining an erection. So, for example, ang mga lalaki is maaaring maka-experience ng intermittent o persistent na problem sa pag-achieve or pag-maintain ng erection, kaya't nahihirapan silang mag-engage sa sexual activities. And third is the inability to become or maintain arousal. So, for example, ang mga babae is maaaring magkaroon ng problem sa physical arousal. And fourth is delayed, infrequent, or absent orgasm. So, for example, may mga tao na nahihirapan mag-climax kahit na may sapat na sexual stimulation na nagkakos ng frustration and dissatisfaction. Fifth is the discomfort or pain during penetration. So, for example, may mga condition like vaginismus or other conditions na maaaring mag-cause ng pain habang nakikipagtalik, kaya't iniiwasan na lang nila yung sexual activity. There are also emotional and behavioral signs. First is the increased dissatisfaction in intimate relationship. So, yung patuloy na sexual issues is maaaring makasira ng emotional bond ng mag-partner na nagkakos ng conflict and resentment. Second is the frustration, anxiety, or sadness about sex. So, yung mga negative emotions tungkol sa sexual performance is maaaring magpalala ng dysfunction and emotional distress. Third is withdrawing from sexual activity due to discomfort. So, maaaring iwasan ng isang tao ang sexual encounters para maiwasan yung pain or embarrassment na nagpapalala sa away sa relationship. So, for the treatment, kadalasan ang paggamot sa sexual dysfunction ay holistic approach, which involves biological, psychological, and social factors. So, ang treatment options ay pwedeng i-tailor sa specific needs ng bawat individual. First is for the psychotherapy, we have cognitive behavioral therapy or CBT. So, tinutulungan ng CBT yung mga patient na ma-identify and mabago yung mga negative thought patterns and behaviors na nagko-contribute sa sexual dysfunction. For example, kapag ang isang tao na may performance anxiety, maaari siyang matutong i-challenge and i-reframe yung kanyang mga takot tungkol sa sexual performance na nagpapababa ng anxiety and para ma-build yung confidence. And we also have lifestyle and medical interventions. First is the stress reduction. So, may mga technique gaya ng mindfulness, meditation, and regular exercise which can help para mabawasan yung stress na isang common din na cause ng sexual dysfunction. So, for the lifestyle changes, yung pagkakaroon ng mas healthy na lifestyle like pag-stop ng smoking, pagbawas ng alcohol intake, and pagkakaroon ng balanced diet is maaaring makatulong sa overall health and sexual function. So, before we proceed sa delayed ejaculation, alamin muna natin what is ejaculation. So, ang ejaculation is a natural process in men where yung semen is expelled from the penis during orgasm. and it usually happens after sexual arousal and stimulation. So normally, yung brain will send signal to the muscle and nerves sa reproductive system which will cause the release of the semen through the urethra. So merong dalawang phases ang ejaculation. First is the emission phase. Ito yung pag-ipon ng seminal fluid sa urethra. And second phase is expulsion phase. So, nagko-contract yung muscles para ilabas yung semen from their private part. So, sa karamihan ng lalaki, ejaculation happens quickly during sexual activity kapag naabot na yung peak ng arousal. And this is considered normal. So, what is a delayed ejaculation? So, ano naman yung delayed ejaculation? So, yung delayed ejaculation is isa siyang uri ng sexual dysfunction kung saan yung isang lalaki is nakakaranas ng matinding delay or hindi nakakaabot sa ejaculation kahit na enough na yung sexual stimulation. So, according sa DSM-5, para masabing delayed ejaculation, kailangan mangyari ito sa 75 to 100% ng sexual encounters sa loob ng 6 months. So, for the symptoms of delayed ejaculation, we have first is the persistent or repeated delay or absence of ejaculation during sexual activity. So, kahit sapat na yung sexual stimulation, matagal or minsan hindi talaga nangyayari yung ejaculation. And some of the warning signs are frustration or emotional distress. So, dahil sa delayed or absence of ejaculation, marami sa mga lalaki ang nakakaranas ng frustration or distress na maaaring nakaka-affect sa kanilang confidence and relationship. Third is the avoidance of sexual activity. So, men tend to avoid sexual activity dahil sa fear na baka they can't perform well, which can cause tension din sa relationship. And fourth is the relationship issues. So, maaaring magkaroon na ng dissatisfaction ang partner which can lead sa emotional distance or conflicts within the relationship. And fifth is the physical fatigue or discomfort. So, dahil sa prolonged sexual activity in trying to reach ejaculation, pwedeng makaranas ng physical exhaustion or pagod or discomfort ang parehong partners. So, what are the causes of delayed ejaculation? So, ang delayed ejaculation is maaaring cause din ng biological, psychological, and social factors. First is the nerve damage. So, ang nerve damage is isa sa mga main cause ng delayed ejaculation. Kasi ang ejaculation process kasi is nakadepende sa proper function ng mga nerves sa genital area. So, kapag yung mga nerves na ito is nasira, for example, dahil sa diabetes, sa surgery, or spinal cord injuries, hindi magiging maayos yung signal transmission papunta sa brain na nagiging cause din ng delayed or absence ejaculation. Now, let's proceed sa theories explaining delayed ejaculation. First, we have psychodynamic theory. So, according sa theory na to, maaaring merong unresolved unconscious conflicts about sa intimacy or sexuality na naghahadlang sa ejaculation. So, for example, pwedeng may guilt or issues about sa sexual pleasure or fear of intimacy na lumalabas bilang physical inability to ejaculate. Second is the biopsychosocial model. So, nakikita ang delayed ejaculation bilang as a result ng combination ng biological, psychological, and social factors. So, sa model na to, ang ejaculation delay is caused ng first biological factor which is yung nerve function, medication effects, and psychological factors naman is because of mental health and anxiety, and sa social factors is ito na yung sa relationship problems or sa cultural factors. So, for the treatment for delayed ejaculation, first is medication adjustment. So, kung ang cause ng delayed ejaculation is ang pag-inom ng gamot like antidepressants, pwedeng i-adjust ng doktor yung recommended dosage ng ibang gamot na hindi nakaka-apekto sa sexual function. Next is the psychotherapy or yung cognitive behavioral therapy or CBT. So, nakaka-help ito sa mga lalaki na baguhin yung mga negative thoughts nila or behaviors na maaaring cause ng problem like anxiety or relationship issues. Or, Pwede ring sex therapy. So, tinutulungan nito yung mag-partner na mag-improve yung kanilang sexual communication and ma-reduce ang anxiety and masolusyonan yung mga intimacy issues ng mag-partner within the relationship. Or, pwede ding treatment ang lifestyle changes. So, yung pagbabawas ng alcohol or drug intake is makahelp sa pag-improve ng sexual performance. And next is stress management techniques like mindfulness or relaxation exercises is pwede rin siyang makahelp na maging mas relaxed during sexual activity. So now, let's discuss erectile disorder. So, ang erectile disorder or tinatawag din na erectile dysfunction is a disorder that affects an individual na magkaroon or mag-maintain ng erection na sapat para sa sexual performance. But first, alamin muna natin what is erection. So, ang erection is nangyayari kapag may sapat na dami ng blood na dumadaloy sa private part ng lalaki bilang response sa sexual arousal or stimulation. So, kapag merong problem sa process na to, maaring magkaroon ng erectile disorder. Usually, nararanasan ito ng mas nakakatandang lalaki, but possible rin ito siyang maranasan ng younger men. For the theories of erectile disorder, sa first theory, we have biopsychosocial model. So, sa theory na to, pinagsama-sama yung three main aspects na nagko-contribute sa pagkakaroon ng erectile disorder. First is the biological. So, kasama dito yung mga condition na sa physical, gaya ng problem sa daluyan ng dugo or vascular problems or pagkakaroon ng imbalance, gaya ng sabi ko kanina, yung mababang testosterone level. And for the psychological factor, tumutukoy naman to siya sa mga mental health issues like anxiety and depression or stress na pwede talagang maka-affect sa sexual performance. And for the social, dito na yung kasama na dito yung mga problems sa relationship or mga pressure na nararanasan ng tao from the society. So, itong theory na to believes na ang erectile disorder is madalas na result from the interaction ng biological, psychological, and social na aspect instead of a one cause lang. So, next theory is the organic versus psychogenic causes. So, sa organic causes, physical na problem ang dahilan ng erectile disorder like mga condition sa heart, mataas na blood pressure, or pagkasira ng nerves. Or pwede ring cause ito ng hormonal imbalances or epekto ng ilang gamot. And sa psychogenic causes naman, connect nila ito sa psychological na aspect gaya ng performance anxiety or depression or anything na negative experiences in the past na merong connect sa sexuality. So, what are the causes of erectile disorder? First is the biological causes, which is yung vascular problems. So, kapag yung daloy ng blood sa private part ng lalaki is limited or mahina, pwedeng mahirapan yung isang tao na magkaroon ng erection. So, may mga condition na nagapasikip ng blood vessels or sakit sa heart or mataas na cholesterol level, o yun siya yung mga pwedeng mag-cause ng ganitong problem. And kasama pa rin sa causes ang hormonal imbalance, chronic illnesses, and psychological factors like anxiety and depression, stress, and yung relationship issues. So, sa lifestyle factors naman is smoking. So, yung smoking is nakakasira siya ng blood vessels na maaaring magpalala din ng erectile disorder. And also, yung excessive alcohol use or yung sobrang pag-inom ng alak is nakakapagpabagal yun siya ng process ng katawan, kabilang na doon yung sexual performance. And also, lack of physical activity. So, ang pagiging sedentary or hindi active is nagpapababa din ng health ng cardiovascular system, which is napakahalaga para sa erection. And it can also be because of obesity. So, pwede ring mag-cause ng yung mga condition gaya ng sakit sa puso, diabetes, or obesity na pwede rin siyang maugnay sa or makonect sa erectile dysfunction. For the treatment of erectile disorder, first is the pharmacotherapy or PDE5 inhibitors like Viagra. So, usually, ito yung mga prescribed para sa erectile dysfunction. So, yung mga gamot na to is nakaka-help sa taas ng daloy ng blood sa penis, kaya mas madali ito na ma-maintain yung erection habang nagkakaroon ng sexual activity. So, para sa mga lalaki na merong erectile disorder, madalas ito yung unang option ng gamot. So, para naman sa mga worst case ng erectile dysfunction, meron pang ibang medical interventions na available like penile implants. So, sa mga situation kung saan hindi na nag-effect yung mga gamot, pwedeng i-consider na magsagawa or mag-undergo ng operation para maglagay ng penile implants. So, yung option na to is usually para lang sa mga hindi na gumagana yung iba bang treatment. So, that's the only time that we can consider this implant. Second is the vacuum devices. So, isa pang option is ang paggamit ng vacuum device, which helps na sa pag-draw ng blood sa penis para makabuo ng erection. Ito siya is a non-invasive treatment na pwedeng gamitin ng mga lalaki na ayaw mag-take ng medication. Third is the hormone replacement therapy. So, kung ang erectile dysfunction is caused ng mababang testosterone level, pwedeng makinabang yung ilang mga lalaki sa hormone replacement therapy para ayusin yung hormonal imbalances nila. So, that's it for my part. Thank you so much po. And now, my groupmates will discuss other topics. Thank you!
Good day to each and everyone. I'm Shalene E. Panagiton. The next topic that I will be discussing is about the female orgasmic disorder. Female orgasmic disorder is inability to achieve an orgasm or noticeably less intense sexual pleasure. Ito yung kapag nakikipag-intercourse ng isang babae is nahihirapan or nagkakaroon siya ng trouble na ma-reach yung orgasm or yung peak or climax ng sexual pleasure. Yung hindi siya nasa-satisfied kahit nafe-feel niya naman na physically okay siya. And according to the SM5, occurs approximately 75 to 100% when there's an occasion of sexual activity. And minimum of 6 months na kapag nakikipag-intercourse ng isang babae is nahihirapan siyang ma-reach yung orgasm. And according to psychodynamic and cognitive theories, they predict that memories of childhood traumas are associated with orgasm problems. Bakit nga ba? Kasi trauma can deeply affect a person's emotion. Natitrigger siya during intimate moments. Especially kapag abusive yung childhood memories ng isang babae, is nagkakaroon siya ng long-lasting emotional pain, anxiety, or depression. Kaya during intimate moments, kapag hindi healthy yung emotion ng isang babae, is mahirapan siyang i-relax yung sarili niya and maging comfortable during sexual activities. Kapag na-trigger yung body or mind ng isang babae due to the past traumatic event, during sexual activities is mahirapan siyang makafocus sa pleasure or ma-reach yung orgasm. Para kasi ma-reach yung orgasm is need ma-relax yung body or yung mind ng isang tao and dapat nakaka-feel siya ng safety and connection sa partner niya. Ano nga ba ang dahilan kung bakit nahihirapan ang isang babae na ma-reach yung orgasm? First is partner factors. Dito, nakapaloob ang partner sexual problems and health status. Kagaya ng sinabi ko kanina, para ma-reach ang orgasm is dapat merong connection and emotional intimacy ang isang babae sa kanyang partner. During intimate moments, kapag yung partner niya is dealing with sexual problems, like erectile disorder na gidiscuss ni Lara, is it may create stress and frustration in the relationship na maaring magkaroon ng lack of emotional connection and awkwardness during intercourse na magiging dahilan na hindi makapag-relax and ma-enjoy ng babae yung intimate moments nila. And Isa din sa reason is yung sa health status ng partner. Kapag mayroong diabetes or heart conditions or fatigue, etc., ang iyong partner is maaaring makaapekto siya na hindi ma-reach ng babae yung orgasm dahil walang enough stimulation na nangyayari. And next is ang relationship factors. Dito is nakapaloob ang poor communication. Ang kakulangan sa communication with your partner is maaaring dahilan siya para hindi ma-reach ng babae yung orgasm kasi baka yung time na want mo ng intimate moments and wala pala siyang mood, hindi ma-enjoy ng partner mo yung mga nangyayari. Discrepancies and desire for sexual activity. Ito yung kapag magkaiba kayo ng gusto during sexual activity. Hindi kayo nagkakaintindihan and yung gusto ng partner mo is ayaw mo and yung gusto mo naman is ayaw ng partner mo. Kaya magiging dahilan na wala kayong emotional intimacy and walang enjoyment during sexual activity. Next is psychological factors. Ito na yung babae is merong anxiety, stress, or etc. Kaya nahihirapan na siyang ma-reach yung orgasm. Hindi ko na siya masyadong elaborate kasi na-discuss na din siya ni Lara. Next, last cause is ang cultural factors. Dahil sa paniniwala ng ibang babae o yung kinalakihan nilang culture is parang taboo, shameful, and sinful sa kanila yung sexual desire and hindi siya appropriate na pag-uusapan. And dahil sa paniniwala nila is nagkakaroon sila ng guilt and discomfort during sexual activity, which can prevent them na ma-enjoy yung intimate moments with their partner and mawawalan sila ng focus on pleasure or relaxation. Next is symptoms and warning signs of female orgasmic disorder. First is delayed, infrequent, absent, or much less intense orgasms. Halimbawa, yung kapag nagkaroon ka ng intercourse with your partner is delayed, infrequent, or hindi ka talaga nakaka-reach sa climax ng sexual pleasure. And isa din sa symptoms is hindi ka nakikipag-cooperate sa sexual activity with your partner. Kapag niyaya ka ng partner mo is ayaw mo or iniiba mo yung usapan, ganon. Or kapag pinag-uusapan nyo is about your sexual activity is parang iniiba mo, parang ina-avoid mo siya. Next is tension in the pelvic area or lack of lubrication. Alam naman siguro natin lahat if saan banda ang pelvic area sa babae. Then, isa sa symptoms na nahirapang ma-achieve ng babae ang orgasm is kapag sumasakit yung pelvic area nila and kulang sila sa lubrication during sexual activity. Ito yung lubrication is ito yung vaginal fluid. Yung vaginal fluid na yun is nagpo-provide siya ng lubrication during sexual activity. And according to DSM, anywhere from 10% to 42% of women would have orgasmic disorder. Next is the treatment of female orgasmic disorder. First is psychotherapy. May help women and they identify and manage fear of vulnerability. Sa pamamagitan ng psychotherapy, makaka-help ang therapist para i-discuss sa kanyang client on how to manage her sexual trauma and trust issues sa kanyang partner. And another treatment is na pwedeng gamitin practicing mindfulness. Ito yung kapag gumagawa kayo ng sexual activity with your partner is dapat nakafocus ka sa kung ano yung nangyayari at that moment, and which is makaka-help sa babae na mag-pay ng attention sa sexual sensations without making judgment sa kung ano yung nangyayari at that moment. Next is stimulation or masturbation. By masturbation, dito ginagawa yung pag-explore para malaman ng isang babae kung what type of touch is pleasurable para sa kanya para ma-reach yung orgasm. Other doctors is nagasuggest sila sa mga couples to try different stimuli like yung mga vibrator or yung mga erotic videos. But hindi ito for all, no? And last treatment is sex therapy. Helps women with their partner deal with issues that affect their sexual life. Sa sex therapy, dito nag-help ang therapist sa kanyang clients kasama yung partner na mapag-uusapan nila kung ano yung mga gusto at hindi gusto during sexual activity. Kayong mag-partner is dapat na pag-usapan nyo yung mga specific sexual problems sa, na nangyayari sa relationship nyo. Next, sexual dysfunction is female sexual interest or arousal disorder. Inability to respond to sexual stimulation, reduced libido, or decreased interest in sexual activities. Itong disorder na to is very understandable na siya. Ito yung kapag niyaya ng lalaki yung partner niya to have sexual activity is binabaliwala niya or ayaw niya dahil hindi siya interesado or meron siyang trouble to becoming aroused during sex. Yung nawala yung desire ng babae to engage in sex. Kahit sinusubukan niyang makipag-intimate sa partner niya is yung body niya hindi nag-respond by becoming aroused, which can make sex less enjoyable or uncomfortable. And ito din yung tinatawag na low sex drive, yung walang gana during sexual activity. According to DSM, occurs approximately 75 to 100% when there's an occasion of sexual activity and minimum of 6 months, which is same lang siya doon sa female orgasmic disorder, and minimum of 6 months na kapag nakikipag-intercourse ang babae is always hindi siya interesado or nadi-decrease yung interest niya in sexual activities. And according to cognitive theories, people with low sexual desire may have particular attitude that contribute to their dysfunction. They suggest na kapag ang isang tao or yung isang babae is mayroong negative thoughts about sex is maaring maging reason yon na mawalan siya ng interest about it. And halimbawa, ang isang babae is mayroong negative beliefs about sa sex, isipin niya na ang sexual activity is shameful, dirty, or mali dahil yun yung pinaniniwalaan niya, which is makaka-apekto sa desire or interest niya na makipag-intercourse with his partner. Next is, ano nga ba ang dahilan kung bakit nagkakaroon ng arousal disorder ang mga babae? First is psychological factors. Ito yung lack of communication between partners and other relationship problems. Kapag kulang ka sa communication with your partner and sa other problems is mahihirapan kang i-consult sa partner mo yung mga gusto and hindi mo gusto, which is can lead to stress, anxiety, etc. na maaapektuhan ang relationship nyo, especially yung sexual activity. And next is unsatisfying sexual experiences. By this, nagkakaroon ng negative feelings and nare-reduce yung sexual confidence ng isang babae. Nare-disappoint sila and they feel embarrassed and nagiging anxious na sila sa future sexual activities. Since sexual arousal requires a sense of relaxation and comfort, kapag anxious yung babae dahil sa unsatisfying sexual experiences niya, mawawalan siya ng mood to have sexual activity and mahihirapan siya to become aroused. Kapag nare-reduce yung sexual confidence ng isang babae, is nalilesen or mawawalan na yung desire niya about sexual activity. Next is physical factors like chronic disorders such as diabetes or heart conditions. Dahil sa tinitake nila na medication is nawawalan sila ng interest sa sexual activity. Kapag ang babae din is nag-menopause na is parang nawawalan na sila ng interest sa sexual activity dahil maraming changes na nangyayari sa katawan and emotions nila. And kapag menopause na yung babae is less na yung napoproduce na estrogen, which is hormones na nagmi-maintain sa sexual health ng isang tao or ng isang babae. And also, ang estrogen is nag-help din siya sa vaginal lubrication and blood flow sa genitals, which is important for arousal. Next is the symptoms and warning signs of female sexual interest or arousal disorder. First is reduce or no interest or thoughts about sex. Kapag niyaya siya ng partner niya, hindi siya interesado. Yung decreased sexual arousal or pleasure during sexual activity. Ito yung low sex drive or yung walang gana ang babae during sexual activity. Next is infrequent or initiation of sexual activity within relationship. Dito naman is yung partner mo nilang always nag-iaya sa'yo na magkaroon kayo ng sexual activity. And yung girl is parang wala siyang paki or hindi siya interesado. Next is reduce or no sensation on the genitals. Ito ay kapag na-decrease na yung blood flow and less na yung blood na napupunta sa genital area ng babae is yung sensation is nare-reduce na or wala na talaga, making it harder to feel aroused. According to DSM, approximately 30% of women experience chronic low desire. Next is treatment of female sexual interest or arousal disorder. First is psychotherapy or sex therapy. May help women to learn how to communicate more openly with their partner para ma-resolve nila yung past traumas na meron ang partner nila. And nangyayari siya in safe place or safe environment. And another treatment is hormones therapy such as estrogen and testosterone. Ito is nag-help to treat low sexual desire in female, especially in going through menopausal. But itong treatment na to is merang benefits and syempre meron din risk na need i-discuss ng doctor or ng therapist. Next, sexual dysfunction is genitopelvic pain or penetration disorder. Itong disorder na to is pain or enormous physical discomfort during sexual intercourse. Ito yung kapag nagkaroon ng sexual activity yung mag-partners or mag-asawa, ang babae is nakaka-feel ng sakit sa kanyang private part or sa kanyang vagina. And also, kapag gumagamit ng tampon or nagkakaroon ng pelvic examination, ang babae is nakaka-feel siya ng sakit sa kanyang vagina. Meron tayong tinatawag na dysphoria. Pain in the pelvic during or after sexual intercourse. Ang dysphoria is from the Greek words for painful mating. Ang dysphoria in women usually has a physical cause. Isa na doon yung injury sustained in childbirth kasi kapag nagkaanak na yung babae is meron ng damage yung vagina niya. Next is vaginismus, an involuntary contractions of muscles making penetration painful. Ito yung during intercourse, nagkakaroon ng involuntary contraction ang muscles sa vagina ng isang babae, which is nag-prevent na makapasok yung penis ng lalaki. Ang factors kung bakit nagkakaroon ng vaginismus ang isang babae is because of fear, including anxiety about intercourse or childhood sexual abuse. Kaya madaming nagsasabi na kapag makipag-intercourse kayo with your husband or wife, is dapat physically and emotionally okay kayo para ma-relax yung mind mo dahil kapag hindi daw physically and emotionally okay and nakipag-intercourse ka with your partner, may possibility na ma-tighten or yung vagina ng babae kasi anxious siya and hindi nare-relax yung mind niya. Another causes are childhood sexual abuse, infection of the vagina or yung tinatawag na urinary tract and marami pang iba. Next is causes of genitopelvic pain or penetration disorder. First is partner's health status or challenges with sexual intercourse. Ito yung during intercourse, nagkakaroon ng challenges ang babae na mag-produce ng vaginal fluid para hindi siya maka-feel ng pain. Next is relationship factors, kagaya din sa female orgasmic disorder, which is na-discuss ko kanina. Kapag magkaiba kayo ng desire ng partner mo or wala kayong communication is nagko-cause siya ng stress and anxiety, which is hindi makarelax yung mind ng babae and maaaring ma-tighten yung vagina niya that can cause pain. Next is history of abuse or poor body image. Like sa discuss ko bago lang yung about sa vaginismus, ang childhood sexual abuse and infection of the vagina can cause pain during intercourse. The next is symptoms of penetration disorder. First is difficulty having intercourse. Ito yung nahihirapan ang babae na makipag-intercourse dahil sa discomfort or pain na nararamdaman niya. Next is genitopelvic pain. Pain na nangyayari around genitals or pelvic area ng babae. The pain can feel sharp, burning, or like pressure kapag nakipag-intercourse siya sa partner niya. Fear of pain or vaginal penetration. Sa past sexual experiences with pain, ang babae is maaaring makadevelop ng stronger fear and anxiety about having intercourse again. The last symptoms is the tension of the pelvic floor muscles. Ito yung nag-tighten or nagasikip ang vagina automatically and hindi siya makontrol when something tries to penetrate the vagina, which is yung i-discuss ko kanina na tinatawag na vaginismus. Last is the treatment of penetration disorder. Is vaginal lubricants and moisturizers include food-based oils. Ito yung madulas na fluid na maaaring makahelp para maiwasan yung dryness and para maiwasan din yung pain during intercourse. Next is pelvic floor physical therapy. Ito yung nagtuturo sa mga kababaihan kung paano nila i-relax yung pelvic muscles nila para maiwasan yung pagsikip ng vagina during intercourse. And dito, tinuturoan din ang mga babae ng iba't ibang movements para ma-stretch yung affected muscles sa vagina. Last treatment is estrogen or DHEA or dihydroepiandrosterone. Ito ay ini-insert sa vagina ng babae, which is na-discuss ko na ang estrogen kanina na siya yung nagme-maintain ng sexual health ng isang tao or ng isang babae. Sa vaginal infections naman is merong antibiotics or antifungal medications which are dapat na-prescribe siya ng doktor mo bago mo gamitin yung antibiotics or antifungal para sa vaginal infections. And that's all for my part. Next presenter is Fatima Dimanan.
Good day everyone and Assalamu alaikum. So in this part, we were going to talk about the male hypoactive sexual desire disorder, premature early ejaculation, and the substance medication-induced sexual dysfunctions. So let's begin with the male hypoactive sexual desire disorders. So ang MHSDD or the male hypoactive sexual desire disorder ay isang sexual disorder na kung saan ang lalaki ay nakakaranas ng lack of sexual desire that causes distress or relationship difficulties, unlike temporary loss of libido due to stress. So this condition lasts for at least 6 months. So we have the theories of male hypoactive sexual desire disorder. The first is psychobiosocial models explain the male hypoactive sexual desire disorder as an interplay between biological, psychological, and social factors. And the number two is cognitive behavioral theories highlight the role of negative beliefs about sexuality. So there are two main ways we understand MHSDD or the male hypoactive sexual desire disorder. The first is the psychobiosocial model na nagsasabing ang hormonal imbalance, stress at emotional problems sa relasyon ay sabay-sabay na nakaka-affect sa sexual desire. And the second is the cognitive behavioral theory, which focuses on negative thinking patterns tulad ng takot sa sexual performance na nagpapababa ng sexual motivation. So the causes of male hypoactive sexual desire disorder, we have hormonal imbalances including low testosterone levels, and the second is stress, anxiety, and depression. The last is relationship conflicts and emotional disconnections. So the low testosterone is often a biological cause of male hypoactive sexual desire disorder. And the psychological factors like depression or anxiety can also affect desire. And the relationship problems such as unresolved conflicts, yung mga tagal ng away sa partner na hindi maresolba, and that can lead to a lack of interest in sexual activity. The symptoms and warning signs. First is persistent lack of sexual fantasies or desire for at least 6 months. The second is avoidance of sexual situations. And the third is lowered response to sexual stimulation and inability to enjoy sexual activity. So, ang mga lalaki ay posibleng mawalan ng sexual fantasies o iwasan ang pakikipagtalik kahit na mag-initiate ang partner nila or ang isang babae. Mahirap para sa kanila ang makipag-engage na nagdudulot ng stress. They may find it hard to enjoy or engage in sexual activities leading to emotional stress. So we have the treatment of male hypoactive sexual desire disorder. First is testosterone replacement therapy if hormonal imbalance is present. The second is psychotherapy, including cognitive behavioral therapy. And the last is addressing relationship issues through couples therapy and open communication. So, treatment depends on the cause. Pwedeng gamutin ito gamit ang hormonal therapy kung mababa ang testosterone. So, para sa psychological factors, makakatulong ang cognitive behavioral therapy. Kung problema sa relasyon ang dahilan in cases involving relationship issues, couples counseling can be effective in restoring intimacy. So, next is premature early ejaculation. Premature ejaculation or PE is a condition where a man ejaculates sooner than he or his partner would like during intercourse, often causing personal and relational distress. So we have the theories of premature early ejaculation. First is neurobiological theories suggest serotonin receptor dysfunction. And the second is psychological perspectives associate PE or premature ejaculation with performance anxiety. So biological, it is linked to serotonin imbalances. Biological factors tulad ng serotonin imbalance ang isa sa mga dahilan ng premature ejaculation. Sa psychological side naman, malaki ang epekto ng performance anxiety kung saan nag-aalala ang lalaki sa kanyang kakayahan kaya napaaga ang ejaculation. So the causes of premature early ejaculations, we have genetic predisposition or neurochemical imbalance, performance-related stress or fear of sexual failure, and the last is relationship problems or lack of sexual experience. So the premature ejaculation can stem from several factors. Pwedeng magmula sa mababang serotonin o stress ang premature ejaculation. So, ang mga lalaki na may masamang sexual experiences noon o nasa ilalim ng matinding stress ay mas madalas magkaroon ng premature ejaculation. So, the symptoms and warnings of premature ejaculation. First is ejaculation occurring within 1 minute of penetration. The second is inability to control ejaculation during intercourse. And the last is emotional distress or frustration affecting the relationship. So, ang pangunahing sintomas ay ang ejaculation within 1 minute of penetration or matapos ang penetration o bago pa man ito mangyari. So, paulit-ulit itong nangyayari at nagdudulot ng frustration para sa mag-partner. And the last is treatment. First is behavioral techniques like the stop-start method. And the second is SSRI to delay ejaculation. And the last is psychological counseling to address anxiety or emotional issues. So there are several ways to manage premature ejaculation. Isa dito ang behavioral techniques tulad ng stop-start method. Pwede rin magreseta ng SSRI para makatulong sa control kung malaki ang bahagi ng anxiety. And pwede rin sa psychotherapy, pwede rin pwede rin ang medication typically used to treat anxiety and can also help delay ejaculation if anxiety is a significant factors and the psychotherapy may be needed. So the last is substance medication induced sexual dysfunction. So this type of sexual dysfunctions is occurs when medications or substances interfere with sexual desire, arousal, or performance. It can significantly disrupt a person's sexual well-being and relationships. So we have the theories of substance medication induced sexual dysfunctions. First is neurochemical disruption. Theories highlight the effect of dopamine and serotonin regulations. And the second is medication-related. Sexual dysfunction can be linked to antipsychotics, SSRI, and recreational substances. So, ayon sa neurochemical theories, ang mga gamot tulad ng SSRI ay nakakaapekto sa dopamine na mahalaga para sa sexual arousal. So, ang alcohol at recreational drugs ay maaari ring makakaapekto sa hormonal levels. Alcohol and recreational drugs impacts hormonal balance and can cause temporary or long-term dysfunctions. So we have the causes. First is chronic use of antidepressants, antipsychotics, or recreational drugs. Second is alcohol abuse or dependence on opioids. Third is sudden withdrawal from specific medications. So the chronic use of antidepressants or antipsychotics is a major cause. Recreational substances like alcohol and opioids also impair sexual functions. In some cases, ang biglaang pagtigil sa mga substances ay nagpapalala ng sintomas. Sa symptoms and warning signs naman, we have reduced sexual desire, arousal issues, or erectile dysfunction. We have delay or absence orgasm, and persistent problems for at least 6 months after starting medication or substance issues. So, individuals with substance-induced dysfunction of pain experience ang pagbaba ng sexual desire, hirap sa arousal o delay orgasm na kadalasang tumatagal ng 6 na buwan or 6 months. These problems tend to persist for at least 6 months after starting the medication or substance. The last is the treatment. First, adjusting medication dosage or switching to alternatives with fewer sexual side effects. The second is psychotherapy to address substance use or mental health issues. And the last is medications like bupropion to mitigate sexual side effects from antidepressants. Treatment options include adjusting the dosage or switching medication under medical supervision. Psychotherapy ay nakakatulong rin para ma-address ang substance use or mental health issues contributing to the dysfunction. In some cases, medications like bupropion are prescribed to para mabawasan ang sexual side effects ng antidepressants. So by the way guys, ang bupropion is an antidepressant used to treat a variety conditions including depressions or EDC. So in summary, ang mga sexual dysfunction like male hypoactive sexual desire disorder, premature early ejaculation, and substance medication-induced sexual dysfunction ay may malaking epekto sa personal health and relationships. These conditions are influenced by variety of biological, psychological, at relational na factors, kabilang ang hormonal imbalance, anxiety, at paggamit ng gamot o alcohol. Early diagnosis and of pain. Communication with healthcare providers and partners are essential for effective management by addressing both the physical and psychological aspects. Individuals can improve their sexual health and regain intimacy in their relationships. So that brings us to the end of my part. Let's proceed to the next reporter. Thank you po.
So good day everyone, I'm Christine Andangan and my report is all about gender dysphoria. So what is gender dysphoria? So gender dysphoria is a condition characterized by a significant incongruence between an individual's experienced gender and their assigned gender, leading to distress and impairment in various aspects of their life. So this report will delve into the history, symptoms, causes, and treatment of gender dysphoria in children, adolescents, and adults. So the history of gender dysphoria. The history of understanding gender dysphoria is a journey marked by evolving terminology and a shift in focus from pathologizing transgender identities to recognizing the distress associated with mismatch between gender identity and assigned sex. The term gender dysphoria wasn't used until 1973. The concept of individuals experiencing distress due to mismatch between their gender identity and assigned sex has been documented for centuries. For instance, in ancient Greece, this was referred to as eunuchoidism. The American Psychiatric Association, or APA, first formally recognized gender identity disorder in the 1980s, initially encompassing terms like transsexuality and gender identity disorder of childhood. In 2013, the APA made a significant change, replacing gender identity disorder with gender dysphoria. In the DSM-5, this shift aimed to reduce stigma and emphasize the distress individuals experience rather than pathologizing their gender identity itself. So this change in terminology has or had a significant impact on how transgender individuals are understood and treated, contributing to a more inclusive and affirming approach to transgender healthcare. So let's proceed to gender dysphoria in children. So gender dysphoria can manifest in children as early as preschool age. While children may not have the language to fully articulate their experiences, they may exhibit behaviors and preferences that are inconsistent with their assigned gender. So for example here is, there's a young child, then pinanganak siyang babae. So, pero yung puso niya is pusong lalaki. So, she wants to be boy talaga. So, dahil doon, she prefer to wear boys clothes. And ang mga laruan niya is pang lalaki lahat. So, this girl may also express a desire to have a boy's name or feel upset when addressed with their assigned name. Kasi gusto talaga ng batang babae na ito is gusto niya talaga is maging lalaki or pusong lalaki talaga siya. So this strong and persistent expression of their gender identity may indicate that the child is experiencing gender dysphoria, and without support, they might face significant emotional distress in environments that do not accept their identity. So yan ang example ko sa yan ang example para sa gender dysphoria in children. So the theories. First is psychodynamic theories. So these psychodynamic theories proposed by Sigmund Freud and Carl Jung. These theories suggest that gender variant behavior arises from parent-infant interpersonal issues or trauma. However, they have been largely discredited due to a lack of scientific support. Next is cognitive and social learning theories. So these theories advocated by Albert Bandura. These theories assert that individuals construct their understanding of gender through ongoing interactions with their environment, emphasizing the importance of social experiences in gender identity development. Next is biological influences. So this area of research examines genetic, epigenetic, hormonal, and neural mechanisms that affect gender identity. Dr. Norman Spock highlights the critical need for gender-affirming care for transgender youth. Next is the biopsychosocial model. This model highlights the interaction of biological, psychological, and social factors in development. So Dr. Diane Ehrensaft promotes viewing gender identity as a spectrum reflecting its complexity. So those are the theories of gender dysphoria in children. So next is the causes of gender dysphoria in children. First is biological factors. So some experts believe that hormonal influences during gestation may contribute to gender dysphoria. So this could involve variation in hormone levels or the fetus sensitivity to hormones. Next is the genetic factors. Research is ongoing to explore potential genetic influences on gender identity and expression, but definitive links are yet to be established. So let's proceed to the causes of gender dysphoria in children. So first is biological factors. Some experts believe that hormonal influences during gestation may contribute to gender dysphoria. This could involve variation in hormone levels or the fetus sensitivity to hormones. So next is genetic factors. Research is ongoing to explore potential genetic influences on gender identity and expression, but definitive links are yet to be established. So biological influences may include hormonal variations during pregnancy that affect fetal brain development, potentially leading to a mismatch between gender identity and assigned sex. So next is psychological factors. Early childhood experiences, family dynamics, interactions with peers, and personal interpretation of gender roles can shape child's understanding of gender. So these experiences can influence the development of gender identity. So for example here is a 8-year-old boy who has always been drawn to nurturing activities such as playing with dolls and helping with mother in the kitchen. So lahat ng ginagawa niya is parang yung ginagawa ng mga kababaihan, ng mga batang babae lang. So in his family, emotional expression is not encouraged. His father often tells him that boys should be tough and should avoid silly activities. So, ang naging resulta, this boy feels that expressing his nurturing side is wrong. So, leading him to suppress those feelings. He starts to act more aggressive and plays rough with other boys, even though it doesn't come naturally to him. So, this boy can have a feeling of distress in ways. Yeah, that's it. So next is social factors. In social factors, societal attitudes and norms.
Cultural norms and gender stereotypes can impact a child's perception of their own gender and how they are expected to behave. So this can contribute to feelings of distress and incongruence. Yeah. So for example, ito is a 9-year-old boy who has a passion for dance. And he loves expressing himself through movement and dreams of becoming a professional dancer one day. Pero itong bata na ito na lalaki is nakatira sa community na ang traditional gender roles is ang pagsasayaw is para lang sa babae, like commonly nasa girl lang. So ang nasa girl lang, and yung mga boys sa lugar na to is ini-expect na ang pinupursu is sports. So ayun na nga, si Jordan is sinabi na ma-interest siya sa dance. Si Jordan, may narinig din siya sa mga paligid ng mga klase niya na kapag dapat daw ang mga boys is naglalaro ng soccer, naglalaro ng sports at hindi nagda-dance. Kasi ganun yung perspective ng mga tao sa paligid nila. So itong si Jordan, hindi niya na tinuloy yung passion niya. Mas pinilit niya yung sarili niya na i-pursue yung pagiging sporty or maglaro na lang ng soccer even though hindi even though hindi siya naging masaya doon, yung bata na yun. So this conflict between his true interests and societal expectations creates feelings of frustration and sadness. So he feels like he can't be himself, leading to a growing sense of incongruence about his identity. So the pressure to conform to traditional masculine roles not only affects his self-confidence or self-esteem, but also it may lead him to isolate himself from pursuing something that truly brings him a joy or kung saan siya masaya. So those are the causes of gender dysphoria in children. Next is the symptoms. So let's proceed to the symptoms of gender dysphoria in children. So first is strong and persistent desire to be the other gender. So this means children may insist they are the other gender, express a strong preference for clothing and toys associated with the other gender, and engage in cross-gender role-playing. So for example here is, itong lalaki na to, itong bata na to is, ini-insist niya sa family or sa mga friends niya na girl siya kasi pusong babae siya kahit pinanganak siyang lalaki. And itong batang lalaki na ito is, nasasaktan siya pag sinabi siya na boy, na parang ini-insist siya na parang siyang boy, ganun. Nasasaktan siya pag ganun. Kasi gusto niya nga maging babae. Sa kagustuhan ng batang lalaki na ito na maging babae, he prefers wearing dresses and playing dolls na mga laruan na pambabae talaga. And ginagaya niya yung mga characters, mga Disney princess, ganon. Kasi nga he really want to be a girl. So that's the example of strong and persistent desire to be the other gender. So next is discomfort with their assigned gender. So this means that children may express a dislike of their genitals, a desire to have the genitals of the other gender, or a strong aversion to the development of secondary sex characteristics that do not align with their experienced gender. So next is distress and impairment. So this means gender dysphoria in children can lead to social anxiety, depression and difficulties with school or social interactions. So those are the symptoms or sign of gender dysphoria in children. So next is the treatment for gender dysphoria in children. So first is gender affirming therapy. So this means therapy can help children explore their gender identity, develop coping mechanisms, and receive support from mental health professionals. Next is social transition. This means allowing children to express their gender identity through clothing, hairstyles, and name and pronoun choices can be crucial for their well-being. So next is puberty blockers. In some cases, puberty blockers can be used to delay the onset of puberty, providing time for children to further explore their gender identity before making decisions about hormone therapy or surgery. So those are the treatment for gender dysphoria in children. So next is the gender dysphoria in adolescents and adults. In adolescence and adulthood, gender dysphoria often involves a more conscious awareness of the incongruence between experienced gender and assigned gender. Individuals may experience a range of emotions, including anxiety, depression, and strong desire to transition to live in alignment with their experienced gender. So next is the theories of gender dysphoria in adolescents. So first theories is brain structure and function. So this research indicates that there are structural and functional sex differences in the brain, influenced by prenatal hormone exposure and genetics. These differences are relevant to the development of gender identity. Dr. Richard Isakowitz focuses on understanding these neural correlates. Next is social and cultural influences. So these societal expectations and cultural norms significantly shape how individuals experience and express their gender identity. Dr. Susan T. Cohen emphasizes the impact of stigma and discrimination which can affect individuals' self-perception and acceptance. Next is minority stress. So transgender individuals often face stress stemming from discrimination and violence. This minority stress can lead to various mental health challenges, including gender dysphoria. Dr. Alan Meyer explores how these stressors affect the mental health of LGBTQ plus individuals. So next is interpersonal relationships. So, this theory, the quality of interpersonal relationships, particularly with parents and peers, plays a crucial role in gender identity development. Dr. Kenneth J. Zucker studies how family dynamics and support impact the well-being of transgender individuals. So, those are the theories about gender dysphoria in adolescents and adults. So similar to children, the causes of gender dysphoria in adolescents and adults are influenced by biological, psychological, and social factors. First is biological factors. Hormonal fluctuations during puberty. The hormonal changes associated with puberty can intensify feelings of gender dysphoria, as physical changes may not align with an individual's experienced gender. So during puberty, hormonal changes can cause physical developments relates to a person's biological sex. For some individuals, these changes can conflict with their gender identity, leading to feeling of gender dysphoria. For example, dito is itong 14-year-old na adolescent na to is pinanganak na babae, pero yung puso niya is lalaki. She wants to be a boy. As puberty begins, he experiences physical changes like breast development and menstruation, which make him uncomfortable. So these changes do not align with his identity as a boy. So it leads increasing his anxiety and distress. So Taylor feels disconnected from his body and wishes for physical changes that match his gender identity. So this cause frustration and a sense of isolation. So next is psychological factors. So that's the example of hormonal fluctuations during puberty, which is the cause of one of the causes of gender dysphoria in adolescents and adults. So next is in the psychological factors. Internalized societal expectations. Adolescents and adults may internalize societal expectations and gender stereotypes, leading to feeling of pressure and distress when their experienced gender doesn't conform to these norms. So this occurs when individuals adopt the gender norms and stereotypes of their culture. This can create pressure to conform, leading to distress when their true gender identity doesn't match the societal norms. So next, in psychological factors, past experiences of discrimination. So past experiences of discrimination include bullying, harassment, or prejudice based on one's gender identity. These negative experiences can worsen mental health challenges and increase feelings of gender dysphoria. So for example, this as transgender woman faced bullying in her workplace for having expressing her identity. So, yung mga ka-workplace niya is minumok siya, use incorrect pronouns. This make her feel isolated and rejected. So these experiences have taken a toll to this transgender woman mental health, leading to anxiety and depression. So the trauma from this discrimination or bullying exacerbates for her feelings of dysphoria as she grapples with both her identity and the hurtful treatment she has endured. So that's the example of past experiences of discrimination. Next is social factors. Lack of social acceptance. A lack of social acceptance and understanding of transgender identities can create a hostile environment, leading to isolation, anxiety, and also depression. So lack of social acceptance refers to situations where society, including family, friends, and communities, does not accept or understand transgender identities. This can create a hostile environment leading to feelings of isolation, anxiety, and also depression. So next is limited access to resources. This means access to gender-affirming healthcare, legal support, and social services can be limited for transgender individuals, contributing to stress and difficulty in navigating their journey. So limited access to resources means that transgender individuals may struggle to find necessary support, such as gender-affirming healthcare like hormone therapy, legal assistance, or social services. This lack of resources can increase stress and make navigating their gender identity more challenging. For example, this transgender woman who wants to start hormone therapy to align her body with her gender identity. But she lives in a small town where there are no local doctors who provide gender-affirming healthcare. And she is unsure of the legal steps she needs to take to change her name on documents. So this limited access to healthcare and legal resources creates additional stress for this trans woman, making her feel stuck and frustrated in her journey towards becoming her true self. So those are the causes of gender dysphoria in adolescents and adults. So let's proceed to the symptoms of gender dysphoria in adolescents and adults. First is the strong desire to be of the other gender. So these symptoms or signs refers to a deep and persistent wish to live as a gender different from the one assigned at birth. Individuals may want to fully transition to their experienced gender, which can include seeking medical treatments like hormone therapy or surgery, as well as making social changes like changing their name or pronouns. Next is discomfort with physical sex characteristics. So individuals may experience discomfort with their genitals or secondary sex characteristics and may seek to modify this through hormone therapy or surgery. Discomfort with physical sex characteristics. So this means individuals with gender dysphoria often feel uncomfortable or unhappy with their physical bodies, but particularly their genitals or secondary sexual characteristics like breast or facial hair. Many seek to change these characteristics through medical interventions such as hormone therapy or surgery. Next is distress and impairment. Gender dysphoria can lead to a mental health challenges, relationship difficulties, and social occupational difficulties. So this means gender dysphoria can lead to significant emotional distress, affecting mental health and overall well-being. This distress can also interfere with relationships, social interactions, and performance at work or school. So those are the symptoms or sign of gender dysphoria in adolescents and adults. So next, let's proceed to the treatment for gender dysphoria in adolescents and adults. First is gender affirming therapy. First is gender affirming therapy. Therapy can help individuals explore their gender identity, develop coping mechanisms, and address mental health concerns. Next is social transition. This may involve adopting a new name and pronouns, dressing in a way that aligns with one's experienced gender, and seeking social acceptance as the desired gender. Next is hormone therapy. Hormone therapy can help individuals align their physical characteristics with their experienced gender. This may involve taking testosterone for transgender men or estrogen and progesterone for transgender women. Next is gender affirming surgery. This means surgery can provide permanent physical changes that align with an individual's experienced gender. So this may include chest surgery, genital surgery, or facial feminization or masculinization procedures.